You're someone with a vision for your practice, for your side hustle, and for your personal journey. But when it comes to establishing your path on how to get to where you want to be with your practice, things get a little messy. You're also someone who'd prefer to go in person instead of to groups and listening to everyone else's story. To me, it sounds like you could benefit from one-on-one consulting with our experienced practice of the practice consultants. From $5.95 a month and up, you can work with a consultant that will give you more direction and practical tried and tested tips matched to you and your goals. For more information, visit practiceofthepractice.com/apply. Again, that's practiceofthepractice.com/apply. This is the Practice of the Practice podcast with Joe Sanok, session number 1132. Welcome to the Practice of the Practice podcast. I'm Joe Sanok, your host, and I am so excited that you are hanging out with me today. Today, we are giving you behind the scenes in regards to our membership communities. And so a lot of our consultants are doing teachings every single week. Every Tuesday, Wednesday, and Thursday, we have live teachings going on in our membership. So we wanted to give you a little behind the scenes. So we're going to be hearing from Nicole talking about what to do when referrals are slow, HR basics with Andrew, client retention with Ashley, scaling with Nicole, choosing the right project management systems, and all sorts of other things over the coming weeks. I can't wait to dig into this with you. If you want help from one of our consultants, please head on over to practiceofthepractice.com/apply. I'll chat with you for 30 minutes to determine if one of our membership communities or consulting might be right for you. Now let's get started with this episode.
So this is currently being recorded during that last week of August, and this is typically a busy week for most people. It's back to school week. It is back to regular routine week, and for a lot of our clients, we usually see, quite an increase as well. So I'm not surprised that there's not a lot of folks here today. So I am just going to go for it and share with you everything I have today on our topic, expanding your reach in terms of marketing. Now, if you've been with me at all before, you know that I have talked a lot about getting creative with marketing, because there's things that work, and for most people, they work every time. And so that's hi, thanks for joining. Those things that typically work every time are going to be those things such as your SEO. We've talked a lot about SEO. They're going to be your regular referral sources. But the purpose of today's discussion is going to be about expanding your reach. And if you've been with me before, I like to get creative with what that could look like. So basically where I want to start today is what expanding your reach looks like in your own communities. Because in my communities with my typical clientele, I am looking specifically at who I can connect with that I know I can get direct referrals from. Okay, so expanding your reach. This is going to be really specific for your community and for your clientele. And what I mean by expanding your reach is who can you build connections with that will be effective direct referral sources for you. If I have a brand new clinician who works with children, the first thing I'm going to ask her to do is build a relationship with the school social workers. If I have a client who is, I just got a new clinician who specializes in postpartum depression, postpartum issues, and some of the infant mental health stuff related to parenting. And she's made a beautiful connection with our local OBGYN offices here in town, and already is getting direct referrals from them. So I want you to think about what your niche is, niche, if you will. And I want you to think about your community, and I want you to think about the specific clientele that you're looking for. And I'm wondering who for you might that be? Who would it be that you would be seeking out in an effort to gain referrals? So that's going to be your first little bit of homework. If you've been with me before, you know that if you're here for the live, webinar, I really like you to consider all of the possibilities. And that means doing homework sometimes, right? A lot of the work's going to happen outside of our time together. So the first thing I'd like you to do for homework today is think about what expanding your reach would mean for you. Who could you build a relationship with, get to know for direct referral sources? So again, I'm going to give you some ideas here. I have 34 clinicians now, and each of my 34 clinicians has a lot of different specialty areas, whether that is working with veterans, whether that is addiction treatment, OBGYN, new mom stuff. I have somebody who really loves working with people who are having sleep disorder issues, which you've been with me before. You've heard me talk about that before. People who work with kids, people who work with families, people who do faith-based counseling. So I guess where I'm at today is just encouraging you to think about who at your practice as a clinician could connect with somebody outside of the direct referral sources you already have and identify what that might look like. So as always, I love to hear from other people, and I have gotten good feedback from folks outside of our live recordings, outside of our live feed, just because they say that hearing from other people is really helpful in these webinars. So I am wondering who'd be willing to share if you were to expand outside of your normal referral sources based on your niche, based on what your clinician specialty areas are, and based on your geographic location, what's somebody that would be beneficial for you as a practice owner to build a relationship with?
I have a question, but I don't know. I don't want to take you off the rails, but it is related. Can I ask? Okay. Here's my question. I'm like, this is actually something I've been thinking about, and I think something I'm not doing well with. And so I'm like more at the primer stage rather than where you are. Expectations of my clinicians to do some of their networking. That's not happening. I'll be honest. Or it's happening with one person, but not with all of them. And so I'm like, okay, I know this is a leadership thing, but I'm still back there. So are you able to speak to that at all before we get into some of the specifics, or no?
Yeah, absolutely. And thank you for bringing that up, because I think it depends on your structure as a practice owner. So if you have 1090s, right, the expectation is that they're doing a little bit more of their networking, their outreach, but at the same time, you're also taking a percentage. And something that my clinicians want to know is, hey, what does this percentage that you're taking, go towards? What are you doing? And so that is a piece to the puzzle that I think can be kind of tricky, right? And I think that's where you're kind of going with that, is this can be kind of tricky, because how much work do we do versus how much work should our clinicians be doing to outreach for their own clients? So my answer to you maybe not be a very specific one, but I think it's about balance, right? As the practice owner, I like to build relationships with community members in an effort for a reputation, in an effort for direct referrals. So I don't want my phone to stop ringing. I want my phone ringing all day long, every day. And so that's my goal, is to build those relationships so that happens. But there's two things that I do to get clinicians on board with doing some of their own networking. The first thing I do is when they first are onboarding with me, I talk to them a lot about what it's like to build relationships with folks and the importance of that, so that they can get the kind of clients they want. Obviously, I work really hard, and so does my intake coordinators, to make sure that when the phone rings, we're making the best fit based on the specialty areas that the clinician has. But they have a better chance of getting the kind of clients they want if they're getting them directly from the referral sources that are going to fit them best. So one thing I do is I really encourage, when I'm onboarding people, that, if your goal is to build your caseload fast, here are some things that you need to do. Start your Psychology Today profile and identify who you can reach out to and say, hey, I'm accepting new clients. These are the people that I see. The second thing that I do is, if I have a clinician, usually our clinicians are quite full, but if they're not full and they're like, wow, I'd really like to build up my caseload, I say, well, who knows that you're practicing here? Who knows that you're the best fit for their client? Well, nobody really knows. Okay, so if nobody knows and you work with children and you're really good at what you do, you should have a relationship with the school social workers. So I guess, like you said, Michelle, it's kind of a leadership piece where we are, guiding them to take a little bit of ownership in their own caseload, which again is tricky. W-2 versus 1099, that can be tricky too, because some people just expect as a W-2 that their caseload is just going to be full. And we're going to do the best we can, but they have to take a little bit of ownership in getting the clients that are the best fit for them. Does anybody else want to speak to that or have anything they'd like to add to that? Again, the folks who watch this recording, I've been getting feedback that they like to hear the interaction and see what other people are doing.
Yeah, no, I'll interact. Because I'll have to jump off in about 20 minutes to head to the office. But no, I really think when you hit on in your onboarding process, like you're setting that expectation, I'm like, ooh, like I have my onboarding list, but talking about who their relationships need to be with, because it's really different than like my relationships, right? Like I'm a psychologist, but I'm also like, as the practice owner, I'm stepping less and less out of that. And what I want is my ultimate goal is that people are picking up the phone asking for those specific people. They're asking for Megan. They're asking for Casey. And right now with back to school, Texas just went back to school. We're on week 3. They're like, my middle of my day's empty all of a sudden. And I'm like, okay, we need to be thinking about who are your clients that can come in the middle of the day. So Megan, who's the play therapist, we need her niching down harder and younger, because those are the people who can leave. You can take your pre-K student out. You can take your kindergarten student out. Whereas I think possibly with some of my clinicians that skew older, I'm like, how do we market you in a way that, or how can you help yourself market yourself in a way that you're finding people who can come during the day? So is it mom groups? Is it, reaching out to MOPS? What is primary care providers rather than pediatricians, right? So yeah, I'm just kind of like, you really like sparked something for me to think about.
Our onboarding, especially new therapists who haven't done this before, they're coming on excited. They're coming on wanting to like take over the world. And I say like, let's figure out how you can put your face out there so that when somebody's at a dinner party and they say, yeah, I've been kind of anxious lately, I don't know what to do, that person at a dinner party is going to say, oh my gosh, Angie over at this practice is the best. And, she's great. You want people knowing your name. And the only way they're going to know your name is if you put yourself out there. Otherwise, you're just another clinician on the list of clinicians at my practice. And our intake coordinator will try their best to schedule for you. But at the end of the day, if they're calling and they're asking for you specifically, that makes everybody's job easier and it's going to get your caseload built a lot faster. Yeah, thank you, Angie. I appreciate that. So yeah, that can be kind of tricky when it comes to that. Exactly how do you entice people? And I will admit, sometimes with 30 plus clinicians, I will get the clinician that says, you know what, I want to show up, I want to see my client, and I want to go home. The percentage that you take covers all of that, and I will expect to have my caseload. And I'll do my best to fill them, but at the end of the day, it is what it is. And it's up to them to have that experience in connecting with others. But I will say, as the practice owner, it has made a huge difference for me to build relationships outside of my practice, even if it's not my niche. I used to work with kids. I don't do that anymore. Not my thing. But I want the school social workers to know my name. I want them to know Nicole at my practice. I want them to know how to get a hold of me. I want them to know the services that we offer. And I'd love to get to a point where I don't have to do that. But school social workers change every year, right? So almost every year. So I've got to reintroduce myself and I've got to say hello to people. And sometimes it can be as simple as an email. But other opportunities like nonprofits, other professions like doctors, lawyers, sleep specialists, a lot of those folks are telling their clients to go to Psychology Today. They're just telling, there's too many practitioners in the area. So they say, go to Psychology Today. But if they know you and they know your face and they trust you, they're going to be much more likely to hand out your card. which is why I still have cards. I know a lot of people are getting away from business cards, but I still buy them, and I buy them in boxes so that I can leave stacks of them everywhere, with doctors, with lawyers, and you will not believe how often people say, yeah, I went to see this lawyer and I told him about this divorce I'm going through and he gave me your card. So people do pass out those cards, especially when you give them a stack because they want to get rid of them. I'm teasing. But in all seriousness, in terms of expanding your reach, my goal for you today is to really think outside of what your normal reach would be and what that could possibly look like. So I want to give you some ideas, and I kind of want to talk about each of them individually. And then if I forgot anything, I'd love to hear your feedback. So I've been talking a lot about schools, so I'm just going to start with that. I want you to think about not just the high school social workers, but the elementary school social workers as well. Something that one of my clinicians did is she started reaching out to the school social workers in the local high schools, but she forgot all about the elementary. And as soon as she did that, we got an influx of calls from them. So don't forget about elementary schools. Don't forget about private schools. Don't forget about charter schools, the Montessoris. And then also don't forget about your local community colleges. A lot of colleges are doing a really, really good job of implementing their own free mental health services, but sometimes they only have so much capacity. And so I encourage you to build relationships with the local counseling centers at your local universities and colleges and community colleges and possibly trade schools. So if there's like a career tech center, oh, that's another great one. We get tons of referrals from the career tech center as well. So anything that is school or educational related can be really, really beneficial, because when somebody's struggling with keeping up with their work, they oftentimes will go see the counselor or go see their advisor. And what happens at an advising appointment, for those of you who've worked in higher ed? Well, you talk about how life is getting in the way of your success in school. It's not that I can't focus on my homework and get homework done. It's I can't focus because A, B, C, and D are happening in my life. And so it's a great opportunity for them to say, hey, have you considered counseling? Have you talked to somebody? Do you have somebody safe you can talk to? So that's the first thing I want to just leave you with is schools, because we get a lot of referrals from schools, and it's definitely one of those things that seems like it's like, oh yeah, no brainer. The schools are going to call us, but the schools are working with very little resources, and they're getting students in their office and out because the next kid's waiting outside the door. They're just putting fires out all day. And so to have somebody's card on hand that they can hand over can be really beneficial. It's important that the school social worker, though, knows what insurances you accept, or if you're private pay, because one thing we ran into years ago is one of the elementary social workers was passing out our cards like candy, and we were getting a lot of Medicaid calls. And unfortunately, we don't accept Medicaid at my practice. And so therefore, we were having to turn those people away. And that was really unfortunate. Okay. The next one is nonprofits. Now, for those of you who accept Medicaid or Medicare, nonprofits are going to be a great source for you. So I want you to, again, if you accept Medicaid or Medicare, consider that to be almost a funnel system. If they've got a stack of your cards, if they know you and they know your practice. Nonprofits provide a lot of great resources to our community members, but they can't do everything. And unfortunately, what we find happen in the field is people are coming in, they are seeking out, food from a food pantry, they're seeking out help writing a PPO, they're seeking out transitional housing options. But at the end of the day, they still need professional mental health services. And so that's another great opportunity. I will say that our relationship with, at my practice at least, our relationship with nonprofits is a good one. We're very involved, but at the same time, because we don't accept Medicaid or Medicare, they can't always send people to us. So that's something to keep in mind as well. So any comments, suggestions, ideas, or advice surrounding nonprofits as a way of expanding your reach? Okay. Like I said, we're getting creative today. So even though you can kind of guess what may be coming next, I'm going to throw a random one out at you. Hairstylists. I know it sounds silly. And the way this happened for me was purely by accident. But my sister-in-law is, she owns her own salon, and she was like, give me a stack of business cards because you won't believe, people talk to me, and I would love just to be able to say, hey, it sounds like you could really use somebody to talk to. Sure enough, that girl starts passing out my cards, and I thought, what a brilliant idea to build relationships with other folks who are in the styling field or in the wellness field. So that's when I reached out to hairstylists. That's when I started reaching out to massage therapists, acupuncturists, energy healers and energy workers, Reiki masters. I mean, I started reaching out to so many people just to see what would happen, right? It was a very experimental thing. And I have to say, I don't get a super ton of referrals from them, but every once in a while I do. And they'll say, oh yeah, my hairstylist said that you'd be a great fit for me. Or, oh yeah, my massage therapist handed me your card. I think it was much more prevalent when we started getting out of COVID, and it kind of came in like wildfire, where we just got a lot of referrals. And again, they've dwindled down now a bit. And so maybe that's my sign, and we'll talk about that in a moment. Signs you need to, get back out there with that expanded reach. But I will say that once that was a really, really kind of cool connection I was able to make. Not only that, but as an individual, being able to connect with people who were doing really amazing work in our community, I had no idea about. I had no idea how many acupuncturists we had in our area. I had no idea the amount of different energy workers that we had in our area. And it was really, really neat to connect with them. And we still get referrals once in a while from those folks. So again, if we're thinking creatively and we're getting outside of our comfort zone, that might be another area. Because if the goal is for your phone to never stop ringing, then there's just another opportunity for another phone call.
As a therapist, I can tell you from experience that having the right EHR is an absolute lifeline. I recommend using Therapy Notes. They make billing, scheduling, note-taking, telehealth, and e-prescribe incredibly easy. Best of all, they offer live telephone support. It's available 7 days a week. You don't have to take my word for it. Do your own research and see for yourself. Therapy Notes is the #1 highest rated EHR system available today, with a 4.9 out of 5 stars on trustpilot.com and on Google. All you have to do is click the link below or type promo code Joe on their website over at therapynotes.com and receive a special 2-month trial absolutely free. Again, that's therapynotes.com, and use promo code Joe on the website. If you're coming from another EHR, Therapy Notes will also import your demographic data quick and easy at no cost, so you can get started right away. Trust me, don't waste any more of your time and try Therapy Notes. Just use promo code Joe at checkout.
Okay, next up is going to be the obvious, healthcare workers, right? And I think that for many of us, this is a tricky one because we have our hospitals and you have your behavioral health unit in the hospital, and you should have a direct relationship with them. We get direct referrals from our local hospital, the big hospital, not just like, the local offices. From our big hospital with the big behavioral health unit, we get direct referrals. So when they're doing discharge planning for somebody who maybe had been inpatient for 3 or 4 days on, risk of self-harm, when they're developing that at-home care plan, we are the first practice that they suggest if that individual does not already have a therapist. And it's really cool because, I would say at least once a week, we're getting a referral directly from the hospital for aftercare. So I would consider building a relationship with the social workers directly at the hospital. Don't go for the bigwigs at the hospital because it's just going to be a waste of your time. Find out who is on the floor directly supervising the behavioral health unit and who is directly working with the social workers and the LPCs that are on that behavioral health unit, because that's how you're going to get those referrals. That has been an amazing referral source for us. And again, it's typically only like 1 fax a week that we get, but that's 4 clients a month that are making ongoing appointments every week, right? So it adds up to be quite a bit. With the healthcare workers as well, I know that for many of us, this is difficult because there's just a lot of healthcare workers out there. There's a lot of small private practice doctors. There's a lot of specialists out there. But we get direct referrals from a handful of the ones that we have kind of chosen to build a relationship with. And it has been really, really amazing. So again, meeting with those doctors, saying hello, shaking a hand, shooting an email, dropping off business cards has been a really great way for us to build our network of people. But I also want you to think about specialty areas. One of the direct referrals we get every single week is from the pediatrician's office. There's 2 major pediatricians in our area of Northern Michigan by Traverse City, and we are getting direct referrals from them weekly. So if a kiddo is struggling with behavioral issues in school, if a kiddo is struggling with anxiety, depression, whatever it might be, parents are going through a divorce, not only will they hand over our card, but we will actually get a direct referral form from them asking us to reach out directly to that client. So that has been a huge source of expanding our reach, is reaching out to those specialty areas. So in the healthcare field, I want you to think about specialty areas. So we have pediatricians, we have gastroenterologists, we have folks who are working with pregnant and parenting women, we have OBGYNs, we have midwives, we have all kinds of opportunities to reach out to these folks and identify exactly, what it is that they're looking for. So again, building that relationship so we can have referrals back and forth, but also seeking out opportunities for us to get direct referrals through that direct relationship. All right. Who else am I forgetting? Like, what are some other healthcare workers or healthcare options that I might be forgetting?
ADHD testing psychologist. So if you have someone that works with ADHD, adult or child.
Yeah, so that's great. If you don't have somebody at your practice that already does any kind of psychological testing, that can be really, really handy as building a relationship. I do have other practices on my list here, but yeah, so working with people who are doing those direct testing can be really helpful.
The one other thing that I thought of was I've had a lot of referrals to me over the years from like integrative, holistic physicians where they'll say, you need to get some EMDR, go find someone who does that. And so that kind of is the cross between like the health and wellness people and your med docs. I think there's that interesting niche there as well.
I agree, absolutely. And I think if you have a specific specialty like EMDR, the whole world needs to know about it. Because I don't know how other geographic areas fare, but in our geographic area, yeah, we have a handful of people who do EMDR in our area. We only have a few that are fully certified in EMDR and or brain spotting. So if you're one of those people, if your schedule isn't full, or if you have clinicians on your team and their schedule isn't full, let people know, because you'll get referrals all day if people know. Okay. The next thing I have is, I'm so sorry. I wanted to mention chiropractors. That's what I forgot. Chiropractors. We hold emotions in our body. And sometimes when we go to see a chiropractor, they might be the first one to notice what we may be holding on to, especially if they're seeing a good chiropractor. So we get a handful of direct referrals from chiropractor offices as well, which is kind of fun because they'll be like, I don't know, the doctor cracked my back and told me I was holding on to my emotions. I don't know what that means, but I'm here to talk to somebody. And we're like, great, we're so glad you're here. Let's talk about it. And it ends up being this beautiful thing where they do have unresolved trauma. They do have something that they're holding on to, and we can help them through that. And it's kind of cool. And I love that chiropractors recognize that holistic connection between the mind and body. With all of the new research over the last 10 years that's coming out about the mind or about the gut-brain connection, right? That's another thing, is those gastroenterologists, talking to them as well if you have that specialty area in your hometown.
Nicole,
okay.
This dentists, if you haven't thought about like talking to your dentist or your local dentists, partly because they will see things in the mouth that we don't get to see. From like our specialty of eating disorders, I've done a lot of education just while I'm sitting in my dentist chair talking about like this is what to look for in a mouth that you might suspect an eating disorder. But then also I always get the talk of like, you're grinding your teeth. Do you have stress? I do. And I also help other people manage stress. Here's my card.
I love it. Thank you so much, Sabrina. That's great. I don't know, dentist never crossed my mind, but that is another and again, that's what this is about today, is expanding your reach, getting creative, figuring out. I've always said that I want people seeing a therapist the way that they see their dentist, having maintenance, having checkups. And the more that we are doing that and having other people build the narrative around it, the more we're breaking down the stigma. And then as business owners, the better that we're going to do in our field, not because we're taking people's money to talk about their feelings, but because we're giving people intentional space to talk about their feelings when other people don't do that. So awesome. Thank you. All right. Next up is other practices. This is a tricky one because I don't know about you, but when I first started my practice, something that I noticed was there was a lot of competition in practices. And maybe it wasn't direct, like nobody was directly being competitive, but it was kind of like this thing that people didn't talk about. And there's a couple of things that I participated in that have made a huge difference in getting referrals from other practices. So the first one is, and you've heard me mention this before if you've been with me for any length of time, but social media and being connected with other therapists on social media has made a huge difference. So one of our local practitioners who owns a practice, she started a Facebook group called, and we're in Traverse City area. It was Traverse City Area Private Practice Therapists. And she invited all the practice owners that she knew and all the clinicians that she knew. And then we all invited clinicians and practice owners we knew. And now there's over 300 people in this group. Yes, it's very saturated up here in Northern Michigan. We got so many people in this group, and it's this beautiful thing because there's probably 10 posts a day of people saying, hey, I'm looking for a clinician who accepts Priority Health, has openings in the evening, and works with young adults. Hey, I'm looking for somebody who does this or specializes in this, or I'm going on maternity leave. Who can take my clients? There's lots of great connections that can happen via social media. And something really cool that's happened from it is because I have built specific relationships with the people on that page, I am now outside of that Facebook page getting referrals directly from them. So rather than typing in, hey, I'm looking for somebody to see a 13-year-old girl on Tuesday evenings, she messages me or my intake coordinator and says, hey, what do you guys got for Wednesday evenings for young adults? Without having to go through that Facebook page. But it kind of started there where you started building those relationships. It's kind of like the new networking, right? We talk about going to those networking events. And if you've been with me, you've heard me talk about how I don't like networking events. But they work for some people, and you do that by building the relationships with people. And so it's kind of the same thing. So other practices are a great referral source. The other thing about working with other practices is if you don't have a spot for somebody, for a client that calls, you need to know who does and who's the best. For example, we don't have a certified sex therapist at my practice, but somebody who owns another practice who I respect and is really, really good at what he does is a fully certified sex therapist. So I can offer those direct referrals to him for those people who are looking for somebody. And then in return, he offers me clients that he thinks would be a best fit for people at my office as well. And so we're having this really beautiful back and forth that doesn't feel competitive. It feels like we are looking out for our clients' best interest. And if that means sending them to somebody else, then we're going to do that. And so it's a really great back and forth. Now, some people are scared to do this because they don't want to show all their cards, so to speak. But I will tell you it's worked for us, and it's been a great way for us to build relationships. And it's been a great way for me to get new clinicians. Not that I'm headhunting clinicians, but because people know about me, they can say, hey, I really love what you're doing over there. Do you have any openings for new therapists? Or I've decided to dissolve my private practice because I don't like the business side of it. Are you accepting new therapists? And before you know it, I have new people that I wasn't even looking for. And that can be really cool too. Okay. I have two more things. Again, this is about expanding our reach. And I know that we've talked about getting involved in the community and attending community events, sponsoring community events, having a booth at a table at a community event. And some people say, you know what, it's not worth it to me. It's not worth if I don't get any direct clients from it. But I will say what is helpful is building out your name and passing out your card. If you have, for example, we have a suicide awareness event in one of our local communities next week, next Friday. And I don't know if we're going to get any clients from it, but it's more about the presence. There's going to be great local agencies there, but we're going to be the only private practice there. So yeah, there's going to be opportunities for them to see what DHHS can offer and see what, the local grief center can offer, or see what, what the local tribes here in Northern Michigan offer. But they're also going to see that there's this private practice, and they're going to see our banner, and they're going to see people sitting at the table, and our business cards are going to be out, and they're going to have a chance to meet us and talk to us and see what we're all about. And so, and the really great thing too, about going to these events is all of my business cards now have the QR code on them. And so if somebody says like, do you have anybody that, specializes in couples work? I can just grab my phone, or they can grab their phone. They can pull up the QR code, and boom, I can say, click this button and here's this guy. He'll be a great fit for you. Why don't you shoot him an email? And that's another great way too. So getting those QR codes on your business cards has turned into a really great thing for my practice. So community events, community expos, whether it's sponsoring charity events, things like that. Now, that's a big job. You've heard me talk about interns before, though. Those are great things for interns. I'm not going to that suicide awareness event next week, but my interns are, and one of my clinicians are, and they're going to do a great job, and I don't have to be there. So keep that in mind. There's beauty in the free work that you can get from your local colleges if you're willing to take on an intern.
I say I have an idea I haven't done it yet, but I've thought it several times. And this kind of goes back with the school stuff too. Schools are always looking for business to sponsor events, or so like every time we go to a college, like a high school football game, there's banners in the stadium of all local businesses and that kind of stuff. And then or like the marching band makes marching band t-shirts every year for their thing, and they're always looking for small businesses to give them money so they can give those t-shirts to the kids for free, and then you have a walking billboard for the next how many years that they wear that band t-shirt. So there's all kinds of ways in that way that you can support local community things like the schools or other things, and get some like free or walking billboards.
I love that. Yes, those are great ideas. So how can you get involved in your own local community, right? I love it. Okay, my last thing is with your local newspapers. And I'm not talking about taking out an ad in your local newspaper, but something that I did something that I do on a monthly basis is I write a monthly wellness column for our local newspaper. And I don't get paid for it. I don't get anything for it. But what I do get is my article in the paper with my picture and my name and my business's name and a link to my business's website. So that does a few things. Number one, I'm providing a service to the community by speaking out about the needs of mental health or mental health issues and breaking the stigma of that. Number two, I'm putting our name out there. So if somebody decides that they need counseling, they can say, oh yeah, I read this article this one time. And then number three, most people are reading digital newspapers. And so they will see the link to my website. They'll click on that link directly. And when you are on when your link is on somebody else's website and it links you from their website to your website, that's called a backlink. And that builds your SEO very fast. So backlinks are a beautiful thing that help build your SEO and get you ranking higher on Google. So anytime that somebody clicks on that link on the local newspaper's website or the local newspaper's Facebook page, and they get directed right to my website, that's called a backlink. And that builds my SEO and keeps me ranking higher in Google every single month. So I know it's kind of a stretch because you're committing to something that can be a bit much. But reaching out to your local newspapers and saying, hey, I enjoy writing and I'm a mental health therapist. Are you in need of anybody to write any columns concerning mental health? Local newspapers love free work because they don't want to have to pay for articles. And if you're willing to write an article for free, it's almost like free advertising. So that's something to think about. Now, I've been doing it for 6 years now, and I don't have that much content in my brain. I ran out of ideas a long time ago. So one thing that I do is with all my clinicians, I say, hey, who wants to be published in the local newspaper? And I make it sound really exciting. Who wants to be published? Who'd be willing to write a 500-word article about something related to mental health and be published in the local newspaper? And they get really excited, and then they do it. So every month to the editor of our local newspaper, I'm submitting the article that somebody else has written, and their name, their picture will be in there, but my website will be in there, right? So it possibly gets them more clients, it gets them more exposure, and it gets people to my website. So that's my other idea about expanding reach, is figuring out how you can expand the reach outside of the local stuff that you're already doing. All right, I want to open it up to you. Tell me what's going on. Tell me what you're thinking. Tell me your ideas.
I'll say I'm definitely with Michelle on how do I encourage my clinicians to do their own, reaching out to their own things, because of they're timid. They don't necessarily, it's something that I don't think as clinicians, when we go into this field, we think about how am I going to talk about myself and how am I going to sell myself? And that can be a hard thing to convince people to do, especially when you're first starting out and you're not super feeling confident about your skills anyways. And then to go out and say that, hey, I'm a good counselor, come see me. But I think some of the ideas that you gave are a good way to kind of get them thinking about, this doesn't have to be difficult or hard either. But even just finding ways that you can get your name on something, even if they're responsible for making sure they get a hold of, the football team every year to get the banner for us on in that stadium. And that's their responsibility to do every year. That would be an amazing thing to do that I wouldn't have to then do.
Say well, if it only gets me a couple of clients a month, is it really worth it? Well, I think it is, because that couple of clients a month, that for me with the pediatrician's office, I get one client a week from the pediatrician's office, but that one client turns into another client because the parents of that child tell the other parents, right? And the kid is coming weekly, and then the kid's sibling grows up and then they're coming weekly. And before you know it, you're building this network off of that one referral. So don't be discouraged if it seems like, well, is it really worth it? I think it is, because it offers an opportunity for people to know who you are and for people to send to you. And I think the thing that I want to leave you with today is just when it comes to that idea of expanding your reach, it can be anything. And if it doesn't work out, you don't do it again. And if it works out, then you just have another direct referral source for you and your clinicians. So it can be this really awesome thing. Anybody else? Comments, questions, ideas they want to share with the group?
Our biggest referral source right now is my primary care clinic. And I think because I recently switched and met with a new doctor, and I spent a lot of time researching her and making sure that she aligned with my values personally and professionally. And then we spent an hour talking about my care and what I do. And I've got some training set up to go in and help them understand how to set up their waiting room and their offices and each exam room from more of a trauma-informed lens. Because right now their waiting room is not trauma-informed. And I made sure to tell them that.
That's a great idea. Yeah, your local doctor, your local dentist, your own people will also get you direct referrals. So that's a great idea.
And I've been telling all of my staff and my 2 interns now of you have business cards, use them. Take them to any doctor appointment you are going to and say, hey, I'm doing this thing. Can I leave some cards with you? These are the people that we like to help. And so far, no doctor has been like, I don't want that.
Well, as always, thank you all for being here. I'll stick around if anybody has questions or anything they want to chat about. But again, I just want to leave you with get creative, think outside the box, give things a try. And if they work, then you're just going to get more clients. And that's what we're here for. So don't be afraid to try new things and put yourself out there in different ways. Thank you all for being here. Reach out if you need me or if you need private consulting with me. Have a great day.
Well, thank you so much for listening to the Practice of the Practice podcast today. These trainings are available in our membership communities. Now, we're going to be opening up our membership communities more than just when we're opening Level Up Week. So if there's one that you are interested in, I would love for you to head on over to practiceofthepractice.com/membership, where there's more details and you can get notifications when those open up. So if you are in solo practice, just getting going, if you are building and sustaining a sustainable solo practice, Next Level Practice is for you. If you are looking to launch a group practice launch is for you, and Group Practice Boss is for all those group practice bosses out there. You know, we also couldn't do this show without amazing sponsors like Therapy Notes. Therapy Notes is the best electronic health records out there. They will help you switch over from your current EHR. They also give you 2 months for free or just money off if you use promo code Joe at checkout. They are phenomenal. They help with automated billing. It's going to make it easier to outsource your billing. So many reasons to switch to Therapy Notes. Just head on over to therapynotes.com, read about it, and at checkout, just use promo code Joe. Thank you so much for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.